I've been certified as an HIV test counselor with AIDS Project Rhode Island for 5 months now. When you tell someone that they have tested positive, it's a life-altering experience. It's been described as a death sentence, a life sentence, a jail sentence, and among the most horrifying news that a person will receive in their lifetime. But I'm not speaking here today as a test counselor. I'm speaking from my experience as a patient, because in September of last year, I tested positive for HIV. I was raised in the type of religious cult where being gay was considered the ultimate sin, and AIDS God's answer to it. I moved to Rhode Island when I was 18 to attend school and start my own life. Venturing alone into what was, for me, a new world without a foundation of support was more dangerous than I could realize. I was so eager to come out of the closet in search of acceptance that I spent a lot of times in bars and clubs where I thought I could meet people who were like me. After a short time, that quest for love and acceptance turned dangerous and tragic. The cocktails and substances that once served me as social lubricants inevitably became aggressive and expensive addictions. What followed was a dark period of using and finding means to get more, so frantic and reckless that maintaining my own safety and knowing the HIV status of my partners was not my concern. It would take me 8 years to find help in a recovery program. By the time I went to be tested for HIV, I think part of me was prepared for what Tom was going to tell me. I had already learned the principle of acceptance in recovery. My concern was not how I got this way. My concern was, what am I going to do about it starting today? I feel very grateful today that I'm healthy and able to be on medication, and having not had the need to pick up a drink or a drug one day at a time for over 14 months. But my story is just one of thousands. I think the most unique thing about it is that I'm willing to tell it. Approximately 80 Americans are diagnosed with HIV each day. Over 80 Rhode Islanders were diagnosed last year. Conservatively, that's about 1 every 4 days. Statistically, this is not a large number, even considering the percentage of positive people that don't know their status. But to me and everyone else here whose lives have been affected by this disease, we know that even 1 is too many. 15,529 Americans died from HIV/AIDS-related causes in 2010. One of them was a friend of mine. I learned that last year's national death toll exceeded 19,000. We know that this is unacceptable. However, many feel so far removed that they don't know how to address the issue. Well, change can be affected by everyone at all levels of society, and this is what it takes. It takes a governor like Lincoln Chafee who ensured that there would be no wait list for any Rhode Island patient to access medication therapy. It takes our allies like Dr. Phil Chan and the team at Miriam Immunology, the Rhode Island Department of Health, Agape, and the Center for AIDS Research, who are working to make pre-exposure prophylaxis available to any at-risk person who needs it. We eagerly anticipate this day. It is the new frontier of prevention. It takes people like Paul Fitzgerald, Stephen Hartley, and Scott Mitchell at AIDS Care Ocean State who have been in this fight from its beginning. It takes the talents of people like Tom Bertrand, Jim Huseman, and Amy Stein, with whom I have the pleasure of working, who help to facilitate the services of AIDS Project Rhode Island, and as you can see, make extraordinary efforts to fund its vital programs. I mention these people by name, not to embarrass them or show favoritism, but to call attention to the fact that it is indeed people who create change, not agencies, but individuals. That being said, I feel that I would be remiss if I did not acknowledge my friend Rich Holcomb and his brave and innovative grassroots outreach initiative targeting Rhode Island's invisible, underserved, and ever-growing population of male sex workers with whom I personally identify, to save them from harm and from disease. If you're not familiar with the work of Project Weber, do become familiar. As the only peer education and support program of its kind in this country, it is an invaluable asset to the harm reduction and HIV prevention efforts of this city and of our state. It takes all the case managers and certified HIV test counselors of our AIDS service organizations who either work for little pay or volunteer their time. It takes an HIV-positive speakers bureau comprised of men and women who are willing to stand up to fear and stigma and rejection, to be vulnerable and share their truth with those who need to hear it. It takes every parent, student, administrator, and teacher to demand adequate and appropriate sex education in their schools. It takes a minister, a preacher, a rabbi, a reverend, and a priest to stand up and speak out, affirming and reaffirming that this disease is not an indictment of sin affecting a small community, but rather a public health crisis that affects us all. There were those who would question the need for such activism on the church level. And I'm here to tell them that as long as there are preachers spewing hate, stigma, and intolerance in the name of God, then certainly there must be an alliance of faith leaders who will stand on my side in the name of dignity and truth. Sometimes, far more often than we realize, all it takes is a friend to intervene and say, I love you, and I'm concerned that your drug and alcohol abuse is affecting your ability to behave safely and responsibly. I believe that people listen. I believe I might have listened had somebody been brave enough to say this to me. You see, it takes each one of you to bring the conversation into your homes, schools, offices, places of worship, and out into the streets to end the stigma by talking openly about HIV. We have in this past year witnessed a bevy of breakthroughs in HIV research. There were exhilarated gasps at the news of the cure, followed by disappointed sighs, realizing we're just not there yet. I hope one day I can stand here and say I used to have HIV. I don't know that I'll ever be cured, but I'll do everything I can to end the stigma that perpetuates this plague by speaking out and advocating and educating as many people as will listen. My name is Anthony. I am not dying, helpless, sick, being punished, guilty, contagious, or dirty. I'm just a person like any one of you who happens to be living in recovery and who happens to be HIV positive. I have my blood tested at least twice a year to monitor my viral load and CD4 cell count. I rely on the AIDS Drug Assistance Program to help cover the $35,000 yearly cost of my prescription. Thankfully, I experience few side effects other than occasional nausea and perpetual dehydration and fatigue. One day, there will be more serious complications, and I will deal with those as they arise. Make no mistake, this is an unfortunate condition, but one for which I have chosen to not be ashamed. I've decided to talk about it, and I need you to talk about it as well. If we can just talk about HIV a little louder and reach out a little farther, we could see the number of new infections in Rhode Island drop to zero. Education. It has and always should be the cornerstone of prevention, but we're living in a different HIV generation now. A generation that presents us with unique challenges. A generation that's more informed and yet more susceptible than ever before. A generation that can be saved not only through education-based prevention, but also through feelings-based interventions. And sharing our stories is the best way I know to reach out and bring these people in from the margins. This is scary for me to come out this way. But I'll tell you what's more scary, that 52 people in this country will die today because nobody talked to them the way I'm talking to you right now. We've been holding this walk for 28 years. That's longer than I've been alive. It's time to finish the work that was started 3 decades ago and finally close this chapter of our history. We've heard it said many times that HIV isn't what it used to be. Well, I challenge that statement. In the 1980s and early 90s, an HIV diagnosis often meant an inevitable AIDS diagnosis because there weren't adequate treatments available. Still, in 2013, nearly 1/3 of new HIV infections nationally leads to an AIDS diagnosis within 12 months due to the failure of early detection, which is caused by nothing but health disparity and the fear of social stigmatization. And Rhode Island falls only a few percentage points below this national average. Don't take off your red ribbons yet, folks. It's not over. We must talk about HIV to instate the level of acceptance and comfortability where everyone can speak openly about their status and access the appropriate health and support services. HIV is just the virus. Stigma is the deadly disease, and one for which we can't sit quietly and pray for a cure. Ladies and gentlemen, we are the cure. Prevention is the solution, and HIV is over if you want it. Thank you.